Going traveling, are you worried about travelers' diarrhea? It's a thing. I'm Dr. Paul Zalzal.
I'm Dr. Brad Wing, and when I travel to countries like that, I definitely get worried about travelers' diarrhea. We brought in a special guest, Dr. Tom Warren, infectious disease expert, to share his knowledge on travelers' diarrhea.
Thank you for coming to talk about this dirty topic.
Okay, so Tom, start at the beginning. What is it, what causes it, and how do people get it?
Yeah, so travelers' diarrhea can be acquired often in tropical countries.
Okay.
Usually caused by bacteria such as E. coli, but can less commonly be caused by viruses or even parasites.
Okay.
Okay, so it's an infectious disease that you obtain. We call it traveler's diarrhea because often you get it when you've been traveling to a country different than where you live, where the standards may be different, the cleanliness standards may be different, the hygiene may be different, and your body's not used to those bacteria and viruses, and you can get infected. You know why they call it Montezuma's revenge? Have you heard that?
I have heard that term.
Montezuma's revenge. It's named after Montezuma II, Aztec emperor, I think in the 1500s or something, was there when Spain came over and kind of conquered. So.
And all the guys from Spain got travelers' diarrhea?
Well, I think the folklore is that Montezuma's revenge.
Sure, took them out?
Yeah. He was Montezuma II, Montezuma #2. Ironic that that's his revenge.
That's ironic. Okay, so how does it present? So people get essentially an infection of their GI tract. Why do we end up getting diarrhea when we have an infection of our GI tract? Because isn't our GI tract just full of bacteria?
Yeah, these particular bacteria have toxins
Okay.
that release and stimulate the bowel to produce a lot of fluid and
Okay.
water.
And so the first symptom is that you get diarrhea. Is this a big problem? Is it a small problem? Is it short-lived? Is it self-limiting?
Yeah, so it's a very common problem, and in most people, it will resolve by itself.
Okay.
And so usually after 2-3 days of diarrhea, people will slowly start getting better.
So your body is literally flushing out the bacteria.
That's
no
right.
pun intended.
Yeah.
Okay.
The risk is, of course, when you get diarrhea, is you're losing a lot of fluid, so you can experience dehydration. And that can be a problem. So you begin feeling like drowsy, somnolent, feeling extremely unwell. That's going on beyond that time period. That means you may be dehydrated and you have to get treatment. The catch-22 is often you get the traveler's diarrhea from the water of the place that you're going to visit.
Yeah.
And then you're trying to rehydrate, which could be a challenge if you don't have access to clean water. So that's what the big risk with diarrhea. Diarrhea is, of course, inconvenient and uncomfortable, but the risk is you get dehydrated from it.
And to the point where I think recently a child in Canada was on vacation in a foreign country and actually passed away.
Really?
By not seeking or not receiving timely care at a resort.
Yeah.
And then essentially, kids are even more vulnerable, right? The extremes of age are more
extremes of
vulnerable.
age,
So
yeah.
really old and really young, or if you're immunocompromised already, those people are very susceptible to losses of large amounts of fluid and electrolytes, leading to. So ultimately, this is a bit of a morbid question, but if you have severe diarrhea, like what do you die from? Are you dying from electrolyte abnormality, or just shutting down peripherally, or?
Yeah, it could be a variety of factors, but
Yeah.
because there's such a loss of water and with that electrolytes, then that can cause serious problems and even death.
Wow.
Okay, and you said if it is E. coli, obviously E. coli is ubiquitous, but there's again many different types of E.
That's
coli,
right.
and these are toxic types of E. coli. Do those toxins only affect the GI tract, or can they affect the kidneys and other systems?
They can affect other systems as well. Yeah.
Okay, so there is toxins being produced by these bacteria that are quite sinister and affecting your GI tract, but it can affect other parts of your body. But for sure, the most common way to really get sick from diarrhea would be a dehydration.
Okay, so let's start at the beginning. So you're on vacation, or heaven forbid, on the plane, and you have this, and you've had it for a little while. First is rehydration and dealing with the symptoms. At what point do you say, well, this is not normal, or this is becoming dangerous for me? At what point should you consider talking to a doctor or a healthcare professional of some
Yeah,
sort?
that's a good question. So again, it is a very common condition, and so some of the red flags that we consider are if there's blood in the diarrhea,
Right.
if it's been going on for more than 7 days,
Okay.
or if, again, if someone at the extremes of age.
Okay.
Or other things, people are passing out or have very high fever.
Right.
In most people, they'll just have bad diarrhea for 2 or 3 days and then slowly start to feel better.
So essentially, you're just really sick.
That's right.
Okay.
All right, so can we talk now about prevention? How can I'm going to go on a trip. It's a 7-day trip. I don't want to ruin it. I'm only going with carry-on, so I only have a certain amount of clothing with me. I do not want to get
Bring
travelers.
extra underwear.
I'm not checking luggage on this trip, okay?
No.
Because you're gonna lose your luggage.
And now they're going to charge you
You're
anyway.
charged. You might
It's
get
too
a small
much. You can't afford
carry-on.
it.
Okay, so I don't have the clothing to get traveler's diarrhea on this trip. How can I avoid it?
So the best prevention is to try to make sure that you're drinking clean water and
Yep.
eating clean food.
Right.
So just being very careful where you eat and drink.
So reputable establishment, I guess, is the first thing. And then, so now you're in your room, and I'm like, listen, I'm not going to drink the water. I'm just going to brush my teeth with it. Is that a big deal?
Well,
It's a little bit of Russian roulette, right?
yeah, there's always a risk, but brushing teeth is certainly a much lower risk than consuming the water itself.
Right.
The
Okay.
other tricky one is the ice cubes, right? You may think, okay, I'm just going to drink bottled beverages, which is good. That's a good idea. Bottled beverages are safer than the tap water, obviously. But where do those ice cubes that you got put in the drink? Did the ice cubes just come from the tap water? That could be a source as well.
Okay.
So the water you drink,
And the
or-
ice cubes. What about prophylactic antibiotics and or vaccinations? What is the evidence, or what are your thoughts on these two things?
So there are a couple of vaccines
Yes.
available. They're good, but they're not going to prevent all.
They're good at
infections.
taking care of the specific pathogen that they're targeted
Exactly.
for, right?
But there's a number of different pathogens.
Right.
So they're not going to prevent everything
okay,
for
so
sure.
unlike other vaccines, this vaccine is not going to prevent you from getting traveler's diarrhea. The other thing we talked about water is the food, right?
Yeah.
The fresh vegetables,
Sure.
if they've been washed by tap water, you're at risk for those. And then and just like some of the meats too, if a burger, for example, is undercooked,
Yep.
another source of that E. coli.
So if you see that guy that says, don't worry, I've been vaccinated, and he's like chugging all the water, just keep an eye on that guy, because 2 days from now, he's not going to be partying quite so hard.
You may not get measles.
Okay, what about antibiotics? Because I've heard that some people are like, oh no, I get my doctor to give me a prescription for antibiotics just in case I get traveler's diarrhea. This is a bit of a dangerous practice, right? From a global health perspective.
Well, certainly we don't recommend prophylactic antibodies.
Okay.
So that means taking antibiotics while you're still feeling well to prevent the infection.
Okay.
We don't recommend that.
Yeah.
It is reasonable to get a prescription from your doctor for something like azithromycin to take with you in case you start feeling very unwell, and particularly if you're in a remote area where you're not going to have immediate access to a healthcare facility.
Just to prevent you from ending up in a really dangerous situation, essentially.
That's right.
Okay.
And generally what we recommend is if you're feeling very unwell or your diarrhea is lasting more than a couple of days, then take the medication.
Right.
And that's azithromycin is the medication?
That's one of them, azithromycin or ciprofloxacin, but generally what I would prescribe is azithromycin.
And the main downside to doing that is, A, it can disrupt your own microbiome, like in case, we don't want to take antibiotics willy-nilly. We've talked lots about how it certainly does significant damage in an effort to protect you, but also because it could lead to resistance in a more global sense.
That's right, yeah. It's only to be taken if
You're
absolutely
sick.
needed, yeah.
Because you could get diarrhea if you take it and you don't have traveler's diarrhea.
That's right. So interestingly, let me know if you've heard anything about this. So I went to Haiti after the earthquake in 2010. I was nervous about getting traveler's diarrhea. So I took Pepto twice a day prophylactically, and I did not get it when about 40% of the people that went on these trips got it. Any evidence for bismuth actually making a difference, or Pepto making a difference?
Or
Prevention.
treatment?
No, prevention.
Yeah, there is some effect for sure to
Right.
prevent it, but we don't recommend it in all travelers.
Right, and the risk is you can get a black tongue. You definitely get a black tarry stool, which is disturbing if you're not expecting it. But I think some of the salicylates that are there
That's
can
right.
help reduce some of the inflammation of the stomach lining, and it's been shown to reduce some of
So
the
you
secretions.
took it for how long before you went?
No, on the trip.
On the trip.
So 2 pills twice a day the whole time that I was there.
And did you take it before you left or once you
No, the
landed?
day, I think it started the day that I left. Yeah,
And
and I
that
didn't
worked
get
for
it. It did, and it's cheap. It's easy and safe. I guess
And
if you have
of
other
one.
issues. No. I looked. There's some research about it, but it prevents it about 50% of the people. Yeah, not guaranteed.
But you can also use that to treat it once you get it, bismuth stuff, right?
You could. So that's a
Yeah.
good question. So say you have diarrhea and you're like, I just can't handle this diarrhea. Some people, when it comes to fevers and diarrhea and things like that, isn't that your body just trying to deal with it? Is there any danger of using an antidiarrheal when you have a lot of diarrhea?
It can be, but certainly things like Imodium or
Yep.
bismuth can be helpful to manage the symptoms.
Okay, to reduce the fluid loss.
Yeah, it can sometimes maybe delay the resolution, but those are things that can be taken.
Okay.
Okay, so we talked about the E. coli and the viruses. What about some of those wonky parasites that can happen? Do you see that often, or is that sort of a rare thing, or worms or different types of parasites that you can get?
Yeah, so parasites can cause diarrhea, particularly ones like Giardia.
Okay.
But usually travelers' diarrhea, particularly travelers who are going for a relatively short stay, a week or two, If they get diarrhea, it's usually going to be a bacteria or a virus. Those are much more common than parasites. Parasites are possible, but usually how they'll manifest is a diarrhea that's really persistent. People with Giardia can have diarrhea for weeks or months.
Is that beaver fever?
That's right.
Yeah, that's very Canadian.
Yeah.
Giardia. So like drinking from a stream probably or whatever. Like, is that where
Yeah,
people
it can
get
be
it?
acquired in North
Camping or
America as
something.
well, but in another place in the world from contaminated food or water as well.
Probably with less beavers.
E. coli is fecal contamination. Is Giardia the same sort of thing?
Yeah,
Fecal
it can be.
contamination. Okay.
Yeah, for sure.
Well, and washing your hands, right? Obviously, that's key.
And
on your
washing
trip.
is key.
Ton of wash. So watch out the water that you're taking, the food you're eating, and wash your hands like crazy when you're traveling.
Now you know. If you have an experience with traveler's diarrhea, share it with us. Not too much detail. And if you like this video, please like it, subscribe to our channel, share it with someone that's interested, and check out our podcast.
And if you have an experience with traveler's diarrhea, don't share it with us. And remember, you are in charge of your own health.
And thanks to Dr. Warren for joining us again.
Thank you.
Thank you.